Health Check with Nurse Jenn is presented by Island Cancer Center.
Hello and half a day, Guahusi Nurse Jenn. It's a new year, and with the new year, you never know when you'll be in the wrong place at the wrong time. It could happen to any of us, anywhere, when suddenly a perfect stranger cuts himself and he's bleeding all over the place. First step, if possible, gently clean with soap and water. Make sure to thoroughly rinse out all the soap to prevent irritation to the wound. Do not use hydrogen peroxide or iodine, which can damage the surrounding tissue area. Next, apply direct pressure onto the cut or wound with a clean cloth, paper towel, or gauze until the bleeding stops. If blood soaks through the material, don't remove the original material, the first gauze. Just keep donning more cloth, more gauze, more paper towels on top of it using direct pressure. If the wound is on the arm or leg, raise the limb above the heart if possible. This is a quick and easy intervention to do to help slow down the bleeding process. Once the cut or wound is stabilized, apply antibiotic cream or ointment to reduce the risk of infection, and then cover with a sterile bandage or dressing. Change the dressing daily to keep the wound clean and dry. However, some cuts or wounds should be treated in an emergency room, such as those that are deep, become numb, spontaneously spurt out blood, and doesn't stop bleeding after 10 minutes of continuous firm and steady pressure. Also, any cuts that occurred from a device that was rusted, jagged, or soiled with dirt or grime, these gotta go to the emergency room. Facial cuts near the eyes, airway, or lips, and of course, if the cut or wound shows signs of infection, redness, discharge, or you have a fever higher than 100 degrees, all of these need to be properly medically treated in a medical facility. And now you know, and knowing is half the battle. I'm Nurse Jenn reminding you, don't wreck yourself, health check yourself.
Health Check with Nurse Jenn is presented by Island Cancer Center.